Welcome, folks. Okay, so my name is Apratim Chowdhury. I'm a new face to many of you. I'm the program director of our health program here at the Compassion Institute. I'm so happy to have you all here. We have an illustrious panel of speakers here today, and they're going to talk a little bit about building compassion at a community health clinic. But before we get into introducing our speakers, I'd like to just very briefly mention the mission of the Compassion Institute, which is to advance compassion as a guiding principle and active force to foster a more caring world. And this seems to be more relevant than ever. And before we get into introductions, it would be great to hear from some of you if you would mind putting your name and where you're coming from in the world in the chat, just so we can get a sense of where our compassionate community is today in our webinar. So folks that are calling in, your name, where you're located, and if you're comfortable, what are you up to in this world? Good. So we'll begin with introductions. First up is Dr. Shireen Mansouri. Hello, Shireen.
Hi, April.
Dr. Mansouri is a family medicine physician. She's one of our OG original certified compassion cultivation teachers and is also our health program content lead. So Shireen and I have the pleasure of working very closely together as we serve different healthcare institutions and organizations around the United States. Welcome, Shireen. Okay, next up is Jenna Pryor. Hello, Jenna.
Hey, great to be here.
Awesome. Jenna and I just had the pleasure of working together here in Tucson, where I am currently. And Jenna is Compassion Institute's Research, Evaluation, and Learning Lead, and really does so much for us. We're so grateful to have you here, Jenna.
Thanks, Apro. Great to be here.
All right. Next up is Dr. Mark Schilt. Hello again, Mark. Good
Hello,
to have you here. Yeah.
hello to everyone on the call. Happy to be here with you today.
Yes, Dr. Schilt is a family medicine physician. He currently serves as the Chief Wellness Officer and is a medical director at Rio Health. And Dr. Schilt will tell us more about Rio Health here in a second. It's an amazing federally qualified health clinic here in Pima County, Tucson, Arizona. Thanks, Mark. And finally, Dr. Lynn Young.
Hi, glad to be here.
Thanks for being here, Dr. DeYoung. Dr. DeYoung is also a family medicine physician at El Rio Community Health Center and is a member of El Rio's Clinician Wellbeing Council. Thanks for being here. So I'm going to pass it off to you, Shireen. Take it away.
Thank you, Apro. So happy to have this group of people here. Thank you, Mark and Lynn, for joining us. My plan for this webinar is really mostly to have a conversation. I'm going to do just a very brief overview of some of the work that CI's done with El Rio. And then I'm going to pass it off to Mark to do an overview of some of the work that El Rio's been doing sort of holistically on clinician well-being, because they've done just some incredible work across the board. Jenna is going to present a very high-level overview of a case study that she's been doing over the last year about the work and some of the pros and cons, barriers and enablers type of thing. And then we're going to have a conversation just about the experience of participating in compassion education. I just want to acknowledge that at this point in the world, there is just this constant change and uncertainty that we're dealing with. And I really want to say that I'm quite happy to be able to spend this hour with a group of people that are so focused on well-being in the healthcare organization, and especially in the organization that you're working with. And this is just a beautiful group of people. So this is going to be the highlight of my day. So I would like to then, I was going to talk a little bit about what we've done with El Rio. So Compassion Institute specifically has been working with El Rio for about 3 years now. And we've had the opportunity to do a number of different pieces of work. We've run a number of cohorts of Caring from the Inside Out, which is a weekly 1 hour a week for a 5-week session that can be taken by anybody in the health organization. We've also done compassion cultivation, a full compassion cultivation, as well as a compassion cultivation workshop, which was a 1-day on-site event. And we've done a number of sort of deeper dives, looking at both peer support as well as leadership from the compassion, with the compassionate lens. And we have ongoing drop-ins that we do once a month, just to check in and reassociate ourselves with compassion practices, sort of little boosters that we can connect with once a month. So I'd like to pass it over to Mark to talk about sort of the larger work that El Rio has done in that well-being sphere.
Sure. Thank you, Shireen. Well, let me just say a little bit more about our organization first. So as Apro mentioned, El Rio Health in Tucson, Arizona, and we are a federally qualified health center, which means that we receive funding from the US government to support the care of patients who are underinsured or uninsured. And so it's one of the few parts of the American healthcare system that is publicly funded. And so really it means that our mission is to provide services to all who need it in our community, but we really function as the safety net for people who don't have options to get care elsewhere because of not having a commercial insurance plan. So we are a fairly large organization in the FQHC world. We have 14 clinic sites, and we care for about 130,000 unique patients each year. And we have about 350 clinicians in various clinical departments, including primary care, so family medicine, internal medicine, pediatrics, as well as dental, behavioral health services, and then a variety of other services, including physical therapy and nutrition, as well as a range of other staff who help us to provide wraparound services for our patients to help meet other social driver needs or other needs that they may have. So our journey around clinician well-being here at El Rio really was born out of the COVID pandemic and seeing the impact that had on our patients, but particularly on our clinicians. There was, I think now there is widespread understanding that the COVID pandemic really kind of revealed a lot of the hidden problems that were happening around physician burnout and clinician burnout, which before maybe weren't so apparent, but really came to the surface during the pandemic. And so we began during the pandemic doing surveys of our clinicians to assess their well-being. And then, of course, once you do a survey and have this data, then you have a responsibility to do something with it. And so that led to the development of our more formal clinician well-being program. And we've really focused in that program on taking a comprehensive approach and building a thoughtful and strategic program so that we, we kind of know where we're aiming, and we know the strategies and tactics that we're going to use to get us there. So it can be easy to just kind of chase, this problem or that problem, or, this intervention. But we really took the time to plan and develop a really kind of cohesive plan to address the issue. And a big part of that is to make sure that we're implementing interventions that address the root causes of burnout and occupational distress among our clinicians. And within that, it's important to understand that those causes include both individual factors, but also factors that are due to our system. And that can include our local organizational system, but also many that are due to our larger healthcare system and the challenges that are inherent there. So we've really focused on, addressing system barriers that get in the way of the well-being of our clinicians, as well as providing them with a menu of options that help to support their personal well-being and help them to support their personal resilience. And Compassion Institute has been a really key part of those personal intervention opportunities that we're able to offer to our clinicians. And I'll just finish up by saying that we've been participating in the American Medical Association's Joy in Medicine program for the last several years, which has been a really great program to provide us with a framework and a roadmap. And they have very specific criteria that you meet. And so we were honored to be recognized initially at the silver recognition level. And then last year in 2024, we were honored to be recognized at the gold level. And we're the only organization in the entire United States last year to receive the gold level recognition. So that was a big honor for us. And it's, as we constantly remind everybody here, not any indication of having completed or arrived anywhere, but just that we are on the journey and heading in the right direction.
Awesome. Thank you, Mark. And I think that is just such, it just speaks to the intentionality that El Rio has put behind the work that you're doing around clinician wellness. I'd like to turn it over to Jenna now to talk a little bit about the case study that you've done.
Thanks, Shireen. Yeah, so last year we started a case study process to basically look at what was the impact of these programs, both on an individual level and on an organizational level at El Rio specifically. So across our 15 cohorts of actual CI programs, not the alumni drop-ins that Shireen mentioned earlier, and with over 270 participants, we did a series of surveys, both before and after the courses, some focus groups with both people that participated in those courses, as well as some people that did not, and then some interviews with key leaders, including Dr. Schilt here, to really find out what that looked like, what was the impact within the organization, what was the impact for individuals on a team level, both for supervisors and direct reports, kind of what did that look like for people, specifically for reducing burnout and really developing those compassionate practices in their day-to-day work. So what we found through these surveys, through the focus groups, through the interviews, was that people generally had improved emotional regulation with things like stress management, managing their own negative self-talk. Those were two of the biggest impacts that we saw as a result of this program. We also had 75% of people report that their mental health and well-being improved, which was really important on an individual level. But I appreciate what Dr. Schultz said about really focusing on self-care, but on the person. So El Rio didn't just focus on, how can we improve the employee? How can we reduce the employee's burnout? It was really from a personal level and looking at the whole person, which is important when we look at some of the case study data because these outcomes were highly relational. The people in these cohorts didn't just use what they learned within themselves. Some people, as an individual, they implemented compassion when they were in between patients. When they were washing their hands, they would take a few seconds, a minute, to just reset. If they had a stressful interaction with a patient or a colleague or supervisor, whoever it was, they would just take a minute to reset. And that's what that looked like for them. But we had a lot of participants saying that they also use this with their direct reports if they were in a management position. It really helped them take a step back and reflect, why are they getting defensive if their direct report is providing feedback? So that self-awareness and that ability to regulate their own emotions before they respond was really helpful. And they said that using compassion practices and these techniques to do that was super helpful in their day-to-day interactions. We also had some people say that they used it with their kids or their spouses, which was very interesting. So again, when we look at what El Rio Health is doing for the employees, but not just to improve their workforce, but to really improve their community and to help reduce the burnout and increase compassion across their community, these are some of the outcomes that we looked at. We also had 2/3 of people report that they did reduce their burnout as a result of these courses. And I won't present too much of the follow-up data in this short spiel that I have, but we did see that a lot of these outcomes did not reduce to the levels that they were before the course within 6 to 8 weeks after they participated in the program. So that stress management piece that I talked about that improved quite a bit, that didn't reduce back down to the level that they felt they had before the course, which is really important because it shows a little bit of long-term skill maintenance, but also that they just felt confident that they were able to do that on a regular basis for that long after having participated in the course. And those alumni drop-ins are definitely helpful for people that participated to kind of help prolong those skills and the effects of the course. We also had a lot of people talk about the sense of community and connection that the course has helped to build. So like I mentioned, this is a cohort model. We had 15 cohorts since 2022. So being able to sit with their peers, sometimes their supervisors, sometimes their direct reports, and practice compassion in a group setting and really have someone to talk about how they're applying those skills in the same organization was really helpful. And those networks continued to be built upon after those cohorts ended, which was really important for El Rio as a whole. Some of the barriers that we saw was that for those people that didn't choose to participate in the program or weren't invited to participate within these cohorts, that sense of having that common language of compassion tended to be a barrier for some people, but we did hear that participants in the courses really wanted everyone to be invited to participate so that they could communicate in the same ways about compassion and self and collective care. So that's something that we noted as a result of this case study. We also had some people who didn't choose to participate report just communication about what the benefits of compassion are, what Compassion Institute is all about, and the benefits of participating in the program. So anything that we can do to really communicate really clearly about the benefits of these programs and what they might see, again, both on an individual level at work and at home, but also in the team space and just overall at El Rio. And that's about it. I could definitely share a lot more data from the case study, but I will stop there and let our other panelists get on with the discussion.
Thank you so much, Jenna. Yeah, so I have some questions I'd love to ask Lynn and Mark and just to have a bit of a conversation. And actually, my first question, which I realize I've never asked you guys before, is I mean, an FHQC, federally qualified health center, it's a very specific type of center, as Mark said. You have very specific needs and population that you're serving. I'd love to know what drew you to working there to begin with, and maybe we'll start with Lynn because you haven't had a chance to speak yet.
Sounds good. So I have to admit, when I think back to 17 years ago, a little more than that now, when I joined El Rio, I don't think I even noticed much about the fact that it was an FQHC. I just thought, oh, those are the hours I want. Yeah, I want to do that. So I was looking to change jobs, and I ended up working for El Rio, and I just have really liked it. In fact, I even had worked for another organization for a little while because I was wanting to add some hours. I'm thinking back now, that was also quite a number of years ago, but I worked for a for-profit group for just a little while, and I didn't last, maybe was it 6 months, 9 months or something. And I realized, wow, this culture, this is not the same. This is just the idea, we're here to do certain things that we do for revenue and make money. And really that's more the emphasis, and not we're here to, at El Rio, we're here to take care of people who really need taking care of. I mean, serving the underserved is real, day to day, moment to moment. We just realize these folks, a lot of them, some of them are our colleagues. I mean, I'm a patient at El Rio as well. So we're not all underserved, but there are just a lot of folks we see who really are struggling day to day with resources and have a lot of challenges. And we do a lot of good work, and we're just pretty dedicated, most of us, and just so many smart people here too, just really good at what they do. The more meetings I go to, the more I'm impressed with my colleagues. The more people I work with, the level of dedication to our work and the feeling that we're all really trying to do this work it's rewarding, be part of a group like this. So yeah, that's why I'm still at El Rio. Maybe not why I joined in the first place, but yeah, just the people and the people we serve, the people who do the work, we're a good group.
Thanks. And Mark?
Yeah, thanks. Yeah, I've been in the FQHC world for about 15 years now, and I think really just attracted to the mission and wanting to be able to play a role in helping to serve those who otherwise really kind of fall through the cracks of our very fractured American healthcare system. And it really, draws me the fact that FQHCs, or as they're often called, community health centers, were born out of a social movement in the 1960s with the civil rights movement and the war on poverty. So it really, it feels like you're part of something bigger than just, a standard medical practice, but that you're really part of a movement, and that there's a strong sense of mission, and that tends to, as Lynn was referencing, that tends to attract people who are really mission driven. So it's you find yourself surrounded by people who share that common sense of purpose and meaning for caring for a really particular patient population. And so, that creates a very strong common shared sense of purpose and collegiality in the work that we do.
I'm about to apply for a job there myself. If I ever
We'd
move.
love to have you, Shireen.
So, I mean, you guys are both busy, both clinicians, as well as each of you wear other hats within the organization and obviously personally as well. And this is for both of you, whoever wants to answer first. Like, what has made it important for you to devote some time to the compassion-based education and the programs that you've participated in?
Should I go ahead and go? I realize you're already muted, Mark. I'll go. It's an outgrowth of my own personal practice. So I was inclined to do it already. I've had a meditation practice on and off for a long time, and so I've been inclined. In fact, I was thinking about this today, you know, just the role of it in daily life. And I remember one short little meditation app blurb I heard at one point saying that, you know, people, they don't want to go out into the world without brushing their hair, or brushing their teeth. And we make time for this because it affects how we present to the world, how we feel like we can interact with other people. Why would we not take similar care with our minds and our hearts before we go out into the world and interact with people? You know, you should take care of, you know, brush your heart, brush your mind, clean it all up before you go out. So it's just sort of part of daily maintenance. You know, you wouldn't show up in the exam room without clean hands, a working stethoscope, having a heart and mind that are similarly prepared, I think is important. And the more, you know, the longer you're in this, the more suffering that you see potentially, and injustices of various kinds, it can feel wearing. And so, at least for me, being with part of the Compassion Institute, upped my game as far as that sort of self-care, being prepared to interact with people, with things like the Tonglen practice, things that just can really make you feel more like you can manage some of these difficult things. The grace from the Upayu, that mnemonic, has been helpful. That's one of my favorites. The grounding and the recalling intention and all of that. So I think just, yeah, getting through the day-to-day difficulties, which pile on. It's like we need to pile on these practices to manage all the other stuff that piles on. So yeah, doing them day to day. It's like dusting, cleaning, brushing your teeth.
I think for me, it's, yeah, many things similar to what Lynn was saying. And, you know, it's easy to feel like just day after day you're being asked to give and give and give. And so it's easy to approach that from a standpoint where that feels depleting over time and just kind of wears you down. And so, yeah, for me, I think a lot of it grew out of my own personal experience through the pandemic, and really, in hindsight, now going through a season of my own burnout during the pandemic, and just you know, wanting to be able to show up in a different way, both at work, and also, you know, in my personal life as well. You know, really kind of not wanting it to be where there would be many evenings where I would, you know, get home from work and just feel like, you know, okay, don't tell me any more problems. I've had my fill today of problem solving. And, you know, that feeling that I was having to, you know, kind of choose where I was able to ration my limited resources of giving and compassion. So, you know, the concept of learning to cultivate compassion as a renewable resource within ourselves was very appealing to me in that regard.
Thanks. And you know, as you kind of went through some of the different programming, was there anything that surprised you And you've each had your own practice before, but anything that surprised you over the last couple of years of participating?
I think the thing that stood out to me, so I've definitely done more of these Compassion Institute experiences than anyone at our organization, because in my role, I'm usually organizing and coordinating them. So I'm involved in that role as well, beyond my initial experience as a participant. So I think what surprised me the first time I went through it, and what I continue to see from other participants is, I signed up for the first course thinking, okay, this is something I'm doing for others, so that I have more compassion for my patients, for my family, for the people around me. And I'm going to learn some skills that I can use with those groups of people. And it turned out the biggest thing I got out of it was things for myself and techniques and skills that I'm applying for myself. But then it turns out that impacts how I am with other people. And so the effects ripple out from there. And that's a very kind of common theme I've witnessed and heard from other participants, as I've said in other experiences, is oh yeah, I've tried a few of these things with my patients, but boy, they're working great for me personally and for my family.
Yeah, I would agree with that. The thing that came to mind for me is also more sort of self-centered types of things, in that I just remember doing some of the questionnaires, I think at one point, on barriers to compassion, and one of the questions that stood out to me was, it was a questionnaire on, a whole list of things that, if I feel compassion for myself, then this, and one of them was, then I won't have, something about, then my high standards might not be what they need to be. If I'm okay with compassionate for myself, maybe not doing such a good job, well, then what does that mean for my standards? And just sort of this striving for excellence thing that I'm attached to. What does that mean for myself, and how I treat myself, and my attitudes toward myself and toward others? And so I think just an increased awareness on my own internal attitudes was probably my biggest surprise, because it's sometimes, not maybe easy, but certainly easier to look around and say, oh, well, this is a problem in the system that causes problems with compassion, is a barrier to compassion. This is my supervisor's problem, or my my patient's problem, or the system's problem. But oh, it's a me problem. So those were helpful. Yeah.
Thank you. And thank you for your honesty about that. I would say that one barrier is a common one for many people in healthcare.
Still working on it.
Speaking for a lot of people. What have you been able to integrate into your daily practice? What are the things that you find yourself actually doing on a day-to-day basis?
Do you mean in clinic or at home, or both?
Either.
So I think the one I do most often is probably a movement practice. So yoga works really well for me. My sitting practice is still spotty, but maybe that's okay. Noting in the moment and connecting and grounding as to what's going on in the moment is probably one that's improved. And the more, honestly, the more we do the drop-in sessions, the easier it gets to do it at work. There's still like this whole, oh, I do self-care at home, but at work, I need to be on task. So that's one of the best things about having these drop-in sessions, is I end up doing them at work, which one makes it feel like that, oh, work actually values this enough to have this be a thing that I do at work. I can close the office door. I can actually say, no, don't interrupt me right now. I'm doing this thing that works that I could do here at work. Thank you, Mark. And then since I have some colleagues who are also doing it, then there's that just little bit of extra feeling like, oh, this practice, it's worth taking an extra moment, taking some time, that's okay to do it at work. Which, intellectually, I'm like, well, of course you got to take care of yourself always. But when it comes push to shove and you're at work and all the demands, like Mark said, it's just about giving more and more. It's harder. So getting that reinforcement to do it in the moment, that's been really helpful.
Thanks, Mark.
For me, it's I think the practice that I've most consistently incorporated into my daily routine is just on my daily or my morning walk with my dog every morning around the neighborhood, is just to think about the people that I'm going to interact with that day, and do a small kind of compassion practice with them in mind. And I found that to be helpful for me. And then I think in my interactions, especially with patients, but at times with colleagues or people that I supervise, I think I've noticed that I have a little better awareness of when the best thing to do is just to be there with them, and maybe not offer a solution in that moment, but just to sit and be present with them in that particular moment. And those are times where I will kind of, as Lynn referenced before, utilize the Tonglen practice to just really kind of focus my presence and awareness with them, and have found that to be really, really useful and helpful as well.
Yeah, I would agree, Mark. Actually, I should have mentioned that one too. It doesn't come up as often necessarily, I would say, not on a daily use, but when you're sitting there and you're thinking, oh my gosh, this person's just a wreck, and what am I supposed to do? And you're part of your left brain or whatever is running around in a little circle going, what do we do? What do we do? What do we do? And the other part of your brain can go, okay, I actually can do something. That the Tonglen practice, this is me doing something helpful, and recognizing that, whew, okay, I do have something to do in this situation that can be a practice that'll help me, it'll help them, and then I'll figure it out once things settle a little bit. but yeah, that Tonglen practice is good.
Yeah, sitting quietly with a patient, that's probably one of the hardest skills that any of us learn. I'd love to hear too if you've seen any changes in the environment around you in terms of like at a team level or organizational level with the people that you're interacting with. We talked about how some of these cohorts, they've been done obviously as groups, relational. And so what have you seen kind of external to yourself?
The group that I've seen that the most with is out of the leadership group that we did. Those are people that much of the time I'm interacting with via email, and we're on virtual meetings where cameras may or may not be on. So it felt like many times they were just a name, and that sometimes interactions could tend to be a little more transactional, because you'd be reaching out to them because you needed them to do something, or vice versa. And just going through that experience with them, especially the in-person component, I think really just I definitely myself noticed a shift afterwards, because now we had this additional connection that was a little more human, and we had participated in the program together, and shared some things vulnerably in that setting, which creates a different kind of relationship than just when you're emailing back and forth with somebody about work stuff. So that's what really comes to mind for me, where I've seen a shift or a difference.
Yeah, I'm trying to think. In some ways, it's a subtle shift. Just like I mentioned before, I think just knowing that our organization values this enough to set aside time and money for it, even though it's not directly revenue generating, is it makes a difference. In terms of the more noticeable things, yeah, I mean, people who've done the class, when you talk to them, it's nice. And even just in passing, if I'm helping somebody figure out how to use the electronic medical record better, which is part of my job as well, is to be a big super user, and I'm working with them, there's just a little more connection. It's that they know that I, just like them, am trying to figure out how to get through my day better, and they, just like me, are trying to get their charting done. We're just trying to get through it, and it's okay if they don't know how to do it, or they were told how to do it and don't remember, and it's just a little more permission to be human in the group, I feel like. So, yeah, it's good.
Awesome. And yes, that work you do with the EMR is, I'm sure, invaluable. Invaluable. So I'd love to hear, I think we can guess at them, but what are some of the barriers to embedding compassion-based practices or education within an organization? And I'd love to hear from both of you on that.
Yeah, certainly, time is always at the top of the list. Is how do you create time for this in busy schedules, and without impacting too significantly our patients' access to care as well. So that's always a barrier that we're finding ourselves kind of working with. It's been very helpful in that regard, to be able to take advantage of Compassion Institute's offering continuing medical education credits for the courses. So that's allowed us to really be able to offer it to our clinicians and say, and here's how you can use the time for it, or designate the time for it. So that's been really helpful. I think just in general, back to what I was saying at the beginning about kind of that balance between system and individual factors, that's certainly a barrier to compassion. If you're just completely overwhelmed by a dysfunctional system, it's a lot more difficult to apply those compassion skills. So, the more we can do to just remove those, annoying barriers that get in the way of taking care of patients and the way you want to, or just getting through your day smoothly, the more we can remove those, that creates additional space then for those compassion skills to kind of flourish within.
Yeah, I don't know if I have a lot to add to that. I mean, Mark's the guy in control of making this happen, and he does a great job. So I'd say a barrier would be not having someone like Mark in your system.
Well, that's a great lead into my next question, was what are the enablers? So Mark,
There you go.
the chief wellness officer position,
Having
obviously.
a chief wellness officer, yeah, having someone that champions it. Well, and just the national increased awareness of this as a thing, of physician burnout being a problem, physician suicide. Oh, that's not good. And yeah, so I think, like Mark said, COVID helped with that, with the silver lining. Yeah, that helps.
Any other enablers
Definitely.
that you would see?
Yeah, I think just having that strong organizational support. And so, yeah, we're just so fortunate here to have an executive leadership team that that really values the importance of the clinician well-being work writ large, but also specifically the compassion training part of it as well. So, yeah, we wouldn't be able to obviously do any of this without our organizational leadership being fully supportive of it, and some of that support is based on creating the opportunity for them to have their own direct experiences with the training as well. So I think that's been really helpful, that it's not just that it's more personal to them, and they've seen firsthand, they've experienced it firsthand, and seen some of the effects for themselves.
Awesome,
Well,
thank you.
and also
Yes,
that
Lynn.
because of the increased public awareness on the national level, we have studies that we can now cite, and the American Academy of Family Physicians has programs that have put together data on burnout and how it affects patients, how it affects revenue, how having more family physicians improves patients' lives, extends people's life expectancy by having more family physicians in a community. These things, so that there's a direct cost to physician burnout that we can cite. The cost of rehiring somebody. Some of them are more obvious, but the benefits of having a provider, a clinician who can listen and be present and all those things, they're actually bringing us data now where we can present that. So if we were in an organization that didn't have that, at least we'd have some sort of fighting chance to promote activities like this. I mean, I'm glad I don't have to do that, but it's good to have that out there for those organizations that don't have our kind of leadership.
Yeah, and it speaks also to the AAFP and the AMA for supporting these types of programs that get that data and those things out there. APRA team, I'm going to bring you back on, and I would love to hear from the audience if there are any questions at all from the people that are attending. Does anybody have any questions for Lynn or Mark? And APRA team has been monitoring the chat, so he's going to field those.
I've learned so much from all of you, and want to express thanks to each of you and all the participants for being here and taking time out of your day to learn and be curious and be connected in a community of compassion. So just want to start with thanks. And I do have a question, which is, how are you two dealing with the uncertainty of providing care with possible cuts? There have been cuts to programs. How has that affected your lives, your colleagues, your system? And what role does compassion have in how you face that uncertainty?
Yeah, I think one of the things that our organization learned from the COVID pandemic is in times of just really significant uncertainty, the importance of communication. And so we really revived the communication structure that we used during COVID, revived that same structure as a method to be able to communicate effectively and transparently with across the organization. So we have regular meetings that involve our executive leadership, and then designated liaisons for different staff roles where information is shared transparently. Here's what we know. Here's what we're monitoring, what we don't know, and an opportunity for discussion and questions. And then those liaisons are responsible for taking the information from that meeting back to their sites and their local teams and dispersing that. And that helps. And sometimes it helps even to just hear your CEO say, we don't know what's going to happen with this, but we're keeping a really close eye on it, and we're making some contingency plans in case something happens that really would impact us. So I think that's been really really important and helpful. And at the same time, part of those meetings almost always includes a reminder of the importance of caring for ourselves during this time and caring for others, and a reminder of the resources that are available within our organization to do that. So I think that's been incredibly important, is just voicing that these are difficult, challenging times. And our chief clinical officer has said multiple times in those meetings, it's okay to not be okay right now. And here's resources that can help support you through this time. So it's really taking it day by day and being not panicking, but also being prepared and really emphasizing that communication.
Yeah, the communication has been very helpful and very good and compassionate in the way it's delivered, which is great. But yeah, I mean, all the tools we've talked about to support the difficulties that we face. I mean, part of these times, there's just so much spiraling, theorizing that, oh my God, this is going to happen, and then that's going to happen, and we're all going to have to move to Canada. So, being present, being grounded, and yet, like Mark said, being prepared. It's a hard balance some days, but yeah. And then just knowing that we have a community that supports us, so helpful.
Takes a lot of courage and strength to say, we don't know what's going to happen, but we can be there for each other. Yeah. Well, folks, we are just nearing the end of our time here together. And again, want to thank our community for coming together. I want to especially thank you, Mark and Lynn, Jenna, and Shireen, for discussing this very important topic. Something that's maybe, we've all received healthcare in one way or another. And what about the healthcare provider? Who's there for them? And so this is something that we really need to be thinking about. And we appreciate you all so much. I also want to give a special shout out to our team behind the scene, Logan and Jonathan and Trisha, for keeping us all together and setting this webinar up for our community. Any last thoughts, folks, before we wrap things up? I have a few announcements.
I just really, really want to thank Mark and Lynn for participating and giving of your time and yourselves for this. So yeah, thank you so much.
You're welcome, and thank you. We're just so grateful you guys are there providing this help for us.
Okay, so much gratitude in the air. I want to point y'all to a few upcoming events and ways to stay connected. I'm going to go ahead and share my screen here so we can see. Of course, we have the Compassion Institute website. You can use the QR code here. Please do check out our YouTube channel. We have number of webinars, helpful tools and resources, conversations like this with different groups, different folks who are living and walking the journey of compassion in their own lives, in their own ways. So it's a great place to get resourced. We would also love to hear your thoughts about this session. So you can follow this link through the QR code. And if you're at all interested in exploring how to bring some of these services to your organization or community, please do reach out. Our line is health@compassioninstitute.com, and you can be in touch. We're happy to have a conversation with y'all. And one last thing, this fall, Shireen, who you all heard from, is hosting a program called Compassion Cultivation in Healthcare. And this is a special program that has been tailored for healthcare professionals, administrators, clinicians, allied health professionals, live in person. So you'll get to be with your peers and get to experience directly firsthand the skills, the practices, the perspectives that Lynn and Mark have talked about in this webinar and have brought to their community in Rio Health. So it's an 8-week program, just an hour a week. And of course, if you're interested in learning more about that, you can click this QR code or go to our website, compassioninstitute.com, and learn more there. So that's our webinar today. Thank you all again for being here. If there was something that really stood out to you, or you're feeling like you might want to share this with someone in your team or in your community, someone you care about, we will send out a recording of this webinar, so stay tuned for that. And please be in touch. We're so happy to have you. Thank y'all. Take care.